and welcome to our presentation. Today we will be talking about diabetes mellitus, and this presentation is created by Fernanda Guevara, Laura Limas, Alexa Rico, and Nicole Vizcarra. Hi, my name is Alexa Rico, and I'm going to start with the Google overview. According to the International Diabetes Federation, over 500 million adults worldwide live with diabetes. Most cases are type 2 diabetes, which is often linked to obesity and a sedentary lifestyle. And most cases are also found in low and middle income countries where healthcare access can be limited. Mm, Diabetes affects also both developed and developing countries, making it a major public health concern worldwide. And if these current trends continue, the number could reach to 782 million people by 2045. Also, some general considerations are that diabetes mellitus is a chronic metabolic disease that affects how the body weekly exploits sugar or glucose. And there are two or three main types, which type 1 is usually diagnosed during childhood. Type 2 is more common in adults. And there's also the gestational diabetes, which occurs during the pregnancy. Also, it is a common risk. The factors include age, family history, having a poor diet, physical inactivity, or being overweight. And if it's not properly managed, diabetes can lead to serious health complications.
In order to understand the diabetes, we also have to understand the physiology of the pancreas. It is made up of two main groups of cells, the pancreatic acini, which are cells that have an exocrine function, and the islets of Langerhans, which are cells that have an endocrine function. This last one is the group involved in diabetes. The islets of Langerhans, in turn, are made up of alpha, beta, and delta cells. Alpha cells produce glucagon. This hormone stimulates the production of glucose by the liver, increasing blood glucose. Beta cells produce insulin. This hormone allows the incorporation of glucose into the cells. The last ones, delta cells, produce somatostatin. This hormone inhibits the secretion of insulin and glucagon. The hormone involved in diabetes is insulin. That's why I'm going to explain its function. When pancreas detects a lack of glucose in the cells, it produces insulin. This insulin travels through the bloodstream to the insulin receptors, opening the cellular membrane, allowing the glucose enter to the cell, giving nutrients to the cell. Once we have understood the before mentioned process, we can understand what is diabetes mellitus. It is a group of metabolic diseases characterized by hyperglycemia, which results from defects in insulin secretion, insulin action, or both. Now, if it is a group of diseases, what are the different types of diabetes? Diabetes type 1 is an autoimmune disease because the immune system does not recognize beta cells nor insulin and destroys them, causing necrosis of the islets and insulin deficiency. Diabetes type 2 is characterized by insulin resistance, in which the insulin receptors don't recognize insulin and cells cannot open to receive glucose, and also is characterized by beta cells dysfunction, in which beta cells don't recognize high or low levels of glucose. The last type of diabetes is gestational diabetes. It occurs during pregnancy and usually disappears after birth. There are more types of diabetes, but I won't mention them due to a matter of time. I just I will just mention that these three types that I have mentioned are the main ones.
Hello, my name is Nicole Vizcarra, and today I'm going to talk about epidemiology and the signs and symptoms of diabetes. Let's begin with the epidemiology of this disease. Diabetes is one of the most common chronic diseases in the world. According to the World Health Organization, more than 800 million people are currently living with diabetes. That number has increased a lot in the past few decades and it's expected to keep growing. In fact, the International Diabetes Federation predicts that by the year 2050, there could be more than 850 million people with diabetes worldwide. The most common type of diabetes is type 2, and it is usually linked to lifestyle factors like poor diet, lack of physical activity, and being overweight or obese. That's why it's more frequent in adults, but nowadays we're seeing more and more young people and even children being diagnosed with type 2 diabetes, which is really concerning. Diabetes is a serious condition because if it's not controlled properly, it can lead to complications like heart disease, kidney failure, nerve damage, and even blindness. That's why understanding the disease and identifying it early is so important. Okay, so now moving on to the signs and symptoms of diabetes. Um, there are several warning signs that someone might have diabetes. Um, One of the most common symptoms is feeling very thirsty all the time. People with diabetes also tend to urinate more often, especially at night. Mm, Another common symptom is feeling extremely tired or lacking energy even after resting. Also, some people might experience blurred vision or notice that their cuts and wounds take a long time to heal, and sometimes um, people lose weight without even trying, which can also be a sign that something is wrong. All of these symptoms can appear slowly, especially in type 2 diabetes. That's why many people don't realize they have it at first. Um, in some cases, people are only diagnosed when they already have serious complications. So I think that paying attention to these signs and getting regular checkups it's really important, especially for people at higher risk, like those with a family history of diabetes or unhealthy habits.
Now, I'm Alexa again, and I'm going to talk about the diagnostic basics. First of all, the diabetes is usually diagnosed using blood tests, or they can also check the glucose levels. A fasting plasma glucose level of 126 milligrams per deciliter or higher can be indicated of diabetes. Another test is the hemoglobin A1C, which shows the average blood sugar over the past 2 or 3 months. And as a result, with the level of 6.5% or higher, it suggests diabetes. Also, doctors use an oral glucose tolerance test or a type of diagnose based on symptoms and a random glucose level or of 200 milligrams per deciliter um, or more. Now, for the prognosis for people with diabetes, it depends on the type of diabetes and how early is diagnosed and how well is management to depend on the treatment. But with proper treatment, many people with diabetes can live long and healthy lives. And however, if it's not controlled, diabetes can lead to serious complications such as heart disease, kidney failure, vision loss, etc. Early detection and consistent treatment is important.
Hi, my name is Laura, and today I will talking about the treatment and prevention of diabetes. The main goals of diabetes treatment are to control blood sugar levels, prevent complications, and of course, improve the patient's quality of life. The first line of treatment includes healthy eating, like a balanced diet, such as consume more veggies, consume more fruits, more grains, and the most important, consume less sugar. Patients need to regularly check their glucose levels to adjust their habits or medication as needed. But some people may require oral drugs or insulin therapy. But the type depends on whether they have type 1 or type 2 diabetes. And this is so important. This is always under a doctor's supervision. Now let's talk about prevention. And here's some great news. Type 2 diabetes is actually preventable. First, your plate matters more than you think. You have to load up with fiber rich foods like whole grains, fresh vegetables, and lean proteins. The second one is get moving in ways you enjoy, like walking, dancing, running, practicing a sport, or whatever you want. It's just more about a consistent activity. And the third one, and I think is the most important, is if you know diabetes runs in your family or if you have struggled with weight, regular checkups can catch warning signs early when they are most manageable. And unfortunately, for type 1 diabetes, we can prevent it yet. So, early detection and proper education make all the difference in living well with it. And that's why awareness is so important.